Hi, this is Dr. F.J. Schofield with Gardner Schofield Chiropractic, your West Bend chiropractor. And in this weekly health tip, I want to go over migraines and headaches. How do they happen? What can you do about them? First of all, a migraine headache is just a lot of head pain, and this migraine is basically a severe headache. Now, I mean, you can see things. They can be in the front of your head, the back of your head. It can be all over. You can have face pain, like trigeminal neuralgia. You could even have numbness, like Bell's palsy. And all that is essentially caused by the same thing. That is an upper cervical subluxation. And what that is, and this is the spine, and your head would sit on top of this bone, okay? And what happens is when the top bone of your neck goes out of alignment in any way, okay, it throws your skull off center, right? And it completely changes the biomechanics of how your spine and nervous system function. In upper cervical research, they've shown if it goes 3/4 of a degree or more, it's almost nothing, you can get nerve interference. Okay, and beyond nerve interference, you can also get mechanical compression of the jugular vein. So that comes down, and when this bone goes out of alignment, it can compress that like a kink in a hose or a rock on a hose, and literally prevent blood draining from your skull, your cranial vault, like it should. Okay, and then it basically gets clogged. Kind of like a toilet that won't flush, it won't go down. You can also get CSF stagnation, so the CSF doesn't flow down your brain like it should. Okay, so it's your head here and your brain, and there's this pump, and so CSF should come up and down, and that bathes the brain. It's kind of like blood for the brain and the nervous system. So it brings it nutrients, it brings it the electrolytes so it can send those electrical impulses, it removes waste. And so when you have that, you literally can get stagnation in the cranial vault, and you can get a lot of pressure. Okay, and so by adjusting, if you're out of alignment, you bring that head, that neck into alignment, that head over, you open that up, that jugular vein, you improve that cerebrospinal fluid flow. You're going to also, there's these ligaments that come and attach on this bone to the spinal cord, and when that moves, it'll literally pull on the spinal cord. And that can create a lot of dural tension, a lot of spinal cord tension, affects cerebrospinal fluid flow again. And so lots of times it's not necessarily a pinching of a nerve, it's more of a stretching of a nerve that can cause a lot of pain, and it can cause headaches, migraines, things like that. Also, you get a lot of muscular tension. When that head goes off center, now that your muscles have to work overtime to try to hold you up against gravity, and they're going to get exhausted and fatigued, and you can get a lot of referred pain into the jaw and things like that. So one of the best things you can do is get your upper neck evaluated by a specific chiropractor. By a specific chiropractor, they're going to take some x-rays and see what's going on with your neck. And one thing that separates us and makes us unique from all the chiropractors in our area is we're the only one certified in upper cervical specific chiropractic. We're the only one that has the equipment and the skill and the training. And what we do is we take very specific x-rays of your upper neck from the side, the front, and the top. So we get a three-dimensional view and see exactly how your neck is positioned. And then if we can help you, we set out a plan. And the beautiful thing about upper cervical specific is we don't have to see that much. Most chiropractors are going to start you 3 times a week because that's how many adjustments they need. Most of the time we start people at twice a week or less. So we don't have to give as many adjustments because it's so powerful and it's so specific. And then what we do is we take post x-rays right after the first adjustment to see how your neck is moving, and then we correct it on that visit. Now you may not feel better right away, but we will literally change the structure of your body, improving its function and the biomechanics, getting that head over your neck. Now we are probably not going to get 100% correction. It does happen, but you can't guarantee it. You have to have certain grooves in your spine. We're just not all made in factories, but on almost everyone, unless there's something very unusual on the x-rays, you can get an improvement, a partial correction or a reduction. And studies have shown if you get 30%, the patient's going to feel better. If you can get close to over 50%, close to 70%, they're going to hold their adjustment for long periods. You can go to our website, westbendchiropractor.com, look at all the testimonials on headaches and migraines. We've helped a lot of people just like you, a lot of your neighbors in West Bend. Just lots and lots of people have come to us and gotten a ton of relief for migraines and headaches. And it's not because we're real special, it's just because we're trained to do this technique, and we spend a lot of hours and a lot of time perfecting the ability to locate, analyze, and correct subluxations, misalignments in the upper neck. And it's amazing the benefits it gets. Another beautiful thing about this technique is it's very gentle. There's no cracking, there's no popping, there's no twisting of the neck. so you don't have to worry about any of that. And we take x-rays to make sure we corrected it, okay? And it just works really, really well for headaches and migraines. So come on in for one of our spinal audits, and we'll check to see how your spine is functioning and if we can help you. Dr. F.J. Schofield with Gardner Schofield Chiropractic, reminding you that health is not a matter of chance, it's a matter of choice. So take charge of your health by choosing wisely, my friends.